All right, here we go. Probably the last lecture before we have a couple of study days. We planned out that your lab practical for the axial skeleton is going to be let's look here. Going to be after break, because otherwise you're only getting this class period, and then we would have it on Monday, which I don't want to do. So it's going to be Wednesday, the 19th of October. It'll be after break. We will have one class period before your exam. Noted the lab practical kind of retakes or demonstration of mastery are due tomorrow. If you want to improve your scores there. Any lingering questions from last time? All right, so we will continue with the axial skeleton. Last couple of slides here. All right. So we went over the kind of big portions of the rib cage. We can also see, we're also going to look at the ribs from kind of a lateral and posterior view. So we'll start with this view, this lateral view. I'm going to start with Roz. Tell me on this line, let's orient ourselves first. Where's anterior and posterior? Yes, so anterior, give me some reference here. What structures are pointing posterior maybe? Posterior, which then would make this anterior. And then let's go this way. Chloe, which way, what am I trying to label with this blue arrow? Okay, and which, give me some structures to reference for where anterior, or excuse me, where superior and inferior are. Which give me a structure on the image that I can reference to be superior and inferior.
Superior is top of the spine.
Top of the spine. So where is the top of the spine here? There's no like quote unquote top. The head's cut off. So I don't know where the top is. Maybe I can use some of the ribs to help me describe superior and inferior. The true ribs are superior, and which ones are the true ribs? 1 through 7. 1, 2, 3, 4, 5, 6, 7. All right, so they're superior. Sure, you can go with that. Superior and inferior. All right. now that we've got some orientation, Chloe told us some of the true ribs. Kayla, you want to tell me a feature of the true ribs that's different from the other ribs? They attach directly to the sternum. Good. That's a good feature to describe them by. And 7. Oh, so then if we have true ribs, Mia, 10, 11, 12. So if we have true ribs, are there other categories of ribs that we have here? And which numbers are those? False ribs. 8 through 10 are false ribs. And why might we call them false ribs? You're not sure? Bree, you want to take a stab at why we might call them false ribs? Kayla kind of started us on true ribs. They connect directly to the sternum. Yeah, so I want you to look at that last, the previous slide that we drew on. Where's that cartilage going? That the false ribs are going into. Yeah, on the previous slide that we had. Yeah, it's just going straight into the cartilage. So they're still kind of full ribs, right? They have that cartilaginous attachment, but that cartilaginous attachment onto the sternum is indirect, and it's through the cartilage on the 7th rib. All right. So you can categorize, the question was, lab packet says false ribs go 8 to 12. So we have 2 categories of ribs, or 2 categories of quote unquote false ribs. So what is that other category then, Ms. Yee? The floating ribs. So floating ribs are false ribs, but we just put them in a kind of subset category because they have different features than the rest of the false ribs. So that's 11 and 12. So anatomists being anatomists, they like their particular categorization because we need to categorize everything. All right, anterior, superior, posterior, inferior, we have true ribs, false ribs, floating ribs. All right. Then we will go back here, get just a different view, once again, of these ribs. We can see these vertebrae as well. Teo, you want to tell me what vertebrae is this leader? Hold on. So we got, let's orient ourselves again. Superior, inferior, and then we're going to have a midline right here. And that's going to be medial out to lateral. So Teo, what vertebrae is this one right here that I'm circling? T1. Thank you. We got T1. So if we know that the first thoracic vertebrae articulates with the first rib, so that's rib 1. So you can go T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. So then, Andrew, when we get through all the thoracic vertebrae, what is this vertebrae that's just below the 12th thoracic vertebrae? Lumbar. So what number, what might be labeled that vertebrae? L1. And we can see L2 creeping out just below on that most inferior portion of the image. Medial lateral. And then we get to appreciate the floating ribs a little bit better. We can see how they don't necessarily articulate with the rest of the ribs, and we can really see how they're floating in this image back here. And then we get the false ribs up in here. And then we get true ribs up here. Okay. So now you can kind of see the differences. We can see kind of where they are, how they're articulating a little bit better from each side. I'm going to skip ahead now and we'll come back so that we can fill in that last one. So now we're just going to go over the sternum. And the sternum has a couple of different parts to it. So we can break it up into 3 parts. The first part is going to be this large, I'll call almost arrowhead shaped process. This process is called the manubrium. And then we have the middle portion. It's called the body, much like the rest of our long bones. However, Grant, you can see here, before we get into this, we're going to orient ourselves once again. So we have dashed line is the midline, and we go out laterally, and then we also have superior and inferior, okay, on this image. So Grant, looking at these 2 images right here, what kind of bone is the sternum? So like sesamoid, long bone, that's the kind of answer I'm looking for. No, it's not a sesamoid bone. What are sesamoid bones? Yep. And what's a feature of a sesamoid bone? So sesamoid bones are embedded within tendons, right? So let's look at the sternum on this picture up here. Does it look like it's going to be embedded in a tendon? No. Okay. And we know, so it's not embedded in a tendon. It's not a sesamoid bone. What other kinds of bones do we have? We have long bones. Okay, so let's list these out here. So we have long bones, sesamoid bones. What other types of bones do we have? Irregular bones. Flat bones. Any others? Short bones. Any others? Okay, it's a pretty good list. So we've already established it's not a sesamoid bone. It's a flat bone. Yeah. Why do you think it's a flat bone? Because it looks flat. That's it. Good job. We got there. Medial lateral, it's a flat bone, manubrium. Then we have the body in the middle right here. So then we also have this little process at the bottom. And this one is called the xiphoid process. Xiphoid process. So xiphoid process, we also have a couple of places where you have attachments. So we can think of, if we look back up here, no, you can't see that. So we have a couple attachment places right here on this lateral view. So we will reorient ourselves here with this one. We have this way and this way. We have posterior, anterior, and then we also have superior and inferior in this image. So we have this first articulation right here. This first joint surface is going to be for the first rib. And then we will have one for, I'm just gonna do this. This is where the second and the third, fourth, fifth, sixth, and seventh all attach. We can also see on this lateral view the xiphoid process down here. Yes, Tim?
Sometimes when I like expand my chest out a bit, like pops.
Is it painful?
No,
Okay.
but like what is that? It's just weird because it feels like it's like some like.
So Tim's question is when he, so what is that motion right there? We haven't gone over motions, have we? I haven't gone over motions in this class yet, have we? No, that's my sports medicine class. Okay. When Tim is kind of opening up his chest, moving his arms back, he feels like his sternum cracks. So the technical term for cracking or noise within your body is called crepitus. It's not, it's just a catch-all term. It doesn't indicate any pathology. Why it happens, there could be a multitude of factors that influence, where your articulation is, how tight or loose that joint is, how tight or loose your pecs are. typically as long as something isn't painful, it's not harmful. So why? Probably just a little tight, joint might be a little loose. As long as it's not painful, you're okay.
Yeah, it just feels like a bit like, it's like restrictive until it pops.
Mhm.
It's like, oh,
Sounds good, Tim.
I just don't know if that's like a.
As long as it's not painful, you're doing okay. So Tim, we also have two other articulations that are on the sternum. You want to take a stab at what might be attaching right about here on both sides. So if it's called the clavicular notch, what might be attaching right there? A clavicle. Yep. So the clavicular notch. So we highlight this one over here as well, where we can see the clavicular notch. And then we have one more notch, Parker. And it's right here below my label of midline. So I'm gonna go ahead and erase jugular notch. Cool, and you can feel your jugular notch. Oh. You can feel your jugular notch just above your sternum, kind of pushing right into your throat, into the soft tissue right there. You can feel your jugular notch. So you got your manubrium, top most superior portion of your sternum. You have the body, kind of middle portion where most of the articulations with the ribs happen. And then you have your xiphoid process. You can also feel your xiphoid process kind of just on the tip, the most inferior portion of your sternum as well. And so then when we look at it in all together with the rest of the ribs, we have, is this pink? Pink. So we have our first 3, 4, 5, 6, 7. And then we have our 3 false ribs. And we have our 2 floating ribs sneaking back behind there. And then we can label the manubrium, the body, and the xiphoid process. All right. And 1, 2, 3, 6, 7, 8, 9, 10, 11, speaking out, and 12. Okay. Any questions on the ribs or sternum? Okay. You can see a much prettier labeled picture here. And then another different picture right here. All right. For the rest of this class and the classes until our lab exam, we'll just do lab. Make sure that you're familiarizing yourself with all of the content in this lecture and if in all the slides. All the slides are on Canvas. I'm going to upload these slides just now. Your retakes for your last lab practical are due by the end of tomorrow. And just make sure you're studying not only the content we covered today, but also in previous lectures on the axial skeleton. All right. Any lingering questions that you want recorded to this lecture? All right.